Hi there, my name is Neil Welch. I am the head of the Sports Surgery Clinic Lab Services and Research within the Sports Medicine Department. Thanks for taking the time out to have a listen and watch this presentation. And I'm going to cover a topic and hopefully convince you a little bit on the importance of fitness. But I'm going to talk about how fit is fit enough for golf. So the Sports Medicine Department is kind of adjacent to the main Sports Surgery Clinic site, for those of you who've been out here. We see about between 600 and 700 patients a week, the majority of whom have some musculoskeletal issue, be that back pain or knee pain. But we also see a portion of patients who are just looking to improve their health and fitness. And it's the experience of these type of services that we're going to draw upon today to talk about the role of aerobic conditioning and aerobic fitness for golf. But first of all, I think it's worth exploring and going through what aerobic fitness is. I'm not going to go into a lot of physiological detail with you. And we'll just do a high-level overview, really. But essentially, aerobic fitness and changes in that is an improvement in the ability of the heart and lungs to move oxygen around the body. So when your muscles work, they use oxygen to help burn fuel in order to be able to continue to deliver force and keep you moving. So any improvement in the ability to move oxygen around the body leads to an increase in your aerobic fitness and an improvement in your efficiency during tasks that require that. Now, golf is a sport that's changed quite a lot over the last couple of decades. And the emphasis on fitness has certainly grown. And that is filtering down towards the amateur levels and the social levels within the game as well, to some extent, I guess. Most of the emphasis has been placed on the role of strength and power, with figures like Bryson DeChambeau highlighting the importance of length in his driving game, and club head speeds and ball velocities are figures that are talked about a lot. We've even covered it in presentations here at the Sports Surgery Clinic before. But what I'm going to do is lean a little bit away from the strength and power side of things and the importance and the relevance of that, and talk more about the aerobic elements within the game and the aerobic demands. So first of all, when we talk about aerobic fitness for golf, why do we need it? What's the point? There are two broad areas where it can have some benefit. One is around improved endurance, and the second is around better mental focus and concentration. We're going to talk about each one of those. So the need or requirement for some kind of endurance comes from essentially the length of the game. And depending on the course that you play and how well you're playing, you can cover anywhere between 6 and 12 kilometers during a round. Okay, which is a decent difference by anyone's yardstick. And in order to be able to support the strength and power demands within the game, having a good aerobic base is important for that. What you'll actually see during the round is your heart rate will vary. So the aerobic demands will vary depending on, I guess, whereabouts on the golf course you are and the mental demands and the mental strain. But anywhere from sort of 52 and 78% of your maximum heart rate is where you can jump around. So it's quite a significant range or change in aerobic demands within the sport. And oftentimes this can be down just to the track that you're playing. So here's a lovely image of Enniscrone. I'm sure there's a few of you on tonight who've played there. Even if the course doesn't have a lot of vertical, but there's a lot of undulation, there's a lot of challenge in that up and down movements, and that's where a lot of the aerobic demands come from. So just making sure you have fitness to make sure that getting around the golf course, regardless of the shots you're playing, is a bit easier, is where the endurance and the aerobic demands and improvement starts to have an impact. When we talk about concentration, studies talk about your aerobic fitness being related to higher executive functioning. So your ability to start making decisions through sustained attention. So, for those of us who start to fade throughout the back nine, oftentimes we can talk about the role of attentional focus being an issue. The fitter we are, the more able we are to sustain high levels of attention to whatever it needs to be that club selection, shot selection, or even just the task demands and being able to execute our golf swing the way we want to. Selective attention. So for those of us who are looking to maybe improve our golf swing and are focusing on certain cues or certain elements within the swing, maybe have been working on it with a coach, being able to stay on message, I guess, with our attention is aided by aerobic fitness. That falls under this higher executive function. And the technique side of the game is something that is impacted massively by level of aerobic conditioning and obviously attentional focus. So any improvements there are obviously going to be beneficial. And then resistance to interference. So the idea that, potentially some of our old habits and old thoughts around our golf swing start to slip back in, or even some jibes with the people that we're playing with. Our ability to kind of resist those and not let them become part of our golf game is also improved by better aerobic fitness. So there's a few areas there where we can start to develop our game just simply by being a little bit fitter. And there's some relatively interesting cases where we can kind of see the role of this, particularly among the elite game. So what I'm showing you here is a graph of heart rate information from Justin Thomas from a couple of years ago. And this was around him making an eagle putt in when he was playing at Sawgrass. And what we'll look at as the first part of this graph here highlighted on the left is as he's starting to get ready for his putt and his pre-putt routine, we can see obviously the importance of the shot. His heart rate starts to climb from below 100 up to 110 beats per minute. The next patch of this graph just demonstrates the effectiveness of his pre-shot routine. So aerobic fitness is going to in part support this. Your ability to lower your heart rate is going to be dictated by the efficiency and the improvement in your heart that you gain from aerobic fitness. So we can see that heart rate drop to below 105 before he takes the putt. And then what we see after this is success and celebration. So obviously he goes a bit bananas at sinking a putt, and he's put himself in a much better position within the tournament there. But some interesting information around maybe how the role of aerobic fitness can benefit our golf game and give you a little bit of better control. Like, who's to say that if Justin Thomas's fitness levels weren't as good and he wasn't able to bring his heart rate down, that he might not have made that shot. And then obviously that's going to impact his earnings. We can imagine the same thing happening for us in our golf games. So is getting a little bit fitter worthy of devoting that much time to improve your game? I'm not going to stand here and say that you should take time away from your practice in order to be able to get fitter, and that's going to have make the magic input into your game to have you reaching a handicap that you're looking to. But it can have some benefits. Probably, I think that the wider benefit of aerobic fitness is something that might swing you towards making a bit of a change. Because there are lots of other benefits to aerobic fitness. And again, I'm not suggesting we all need to be looking like this in our later years, but certainly we start thinking about the longevity effects of being more aerobically fit. And there are a number of areas where we can see improvement. So a healthier cardiovascular system is one of them. What we'll see is a reduced gain in weight as we go year on year. Aerobic fitness is vitally important for that. We see reduced inflammation within the body, and anyone who's had issues with joint pain in the past is probably going to understand the roles of inflammation there, and we'll talk about that in a second. And then reducing the risk of developing chronic diseases. So just staying healthy throughout our life and making sure we're living as long a life as possible. So when we're talking about cardiovascular health, essentially we're looking at the improvement within the heart itself, the circulatory system behind that, and then also the lungs. And there are certain adaptations that we get with our fitness work, our aerobic training. So increases in our heart stroke volume. This is essentially the amount of blood that the heart can pump in each heartbeat. So as you get fitter, the heart itself changes. Certain elements within it get bigger. It's able to bring more blood into it and to pump more blood around the heart. This is what contributes to a reduced resting heart rate. So effectively, the heart is more efficient, which, like, as your demands, your aerobic demands increase, your heart just doesn't have to work as hard. What we also get is an improvement of the way we move oxygen around the body. So you actually, within muscles themselves, increase the number of capillaries. They're the smallest blood vessels that we have. We get a large number of capillaries in and around the muscles to deliver blood around the muscles and therefore oxygen to help us become more efficient at burning fuel and using the muscles. The final area, or one of the final areas that we improve is what we call gas exchange in the lungs. So when you breathe in, the oxygen is moved from the lungs to the blood, and we become more efficient at doing that. So again, there's lots of physiological changes that happen in the body to impact and improve the cardiovascular system. In terms of reducing weight gain, a lot of people lean quite heavily on aerobic exercise as a way to reduce weight. That's not necessarily what the science would support. It's more important for preventing weight gain. And what I'm going to show you here is the results of a study that took two groups. So if you look at the dotted lines, the two lines at the top, this is a group of individuals who did 12 weeks of a calorie deficit diet. What we'll see is the total weight loss over 12 weeks in kilograms there. So over kind of 12 kilos. The black line is those who ran the calorie deficit diet, but also completed exercise. And we'll see how, again, tracking the same sort of thing. There's a small, slightly larger drop in weight, but both groups lose weight just through having a calorie deficit. However, what you'll see on the other side of this graph is the follow-up a couple of years later. So the group that kind of continued with their exercises, they're the two lines at the bottom, they had experienced a lower regain in weight, a lower bounce back. The group that didn't complete any aerobic exercise alongside it, they demonstrated just over 50% regain of the weight that they had lost. So this kind of demonstrates and highlights the role of aerobic fitness for just making sure we don't put weight on. Some of us have probably experienced an injury at some point that has meant we haven't been able to continue running or continue cycling to the same level, or potentially had kids, and that's impacted the amount of fitness work you can do, and have experienced some weight gain as a result. So just simply going down a track where we start to do a little bit more aerobic exercise becomes important from the weight management side of things for us. In terms of reducing inflammation, aerobic exercises reduces the amount of fat that's stored around the organs. Now that fat, and any fat within the body really, helps to store inflammatory metabolites. The more this around there is, the more low-level inflammation exists in the body. And aerobic exercises can help to break down that fat and to reduce and to actually increase the amount of anti-inflammatory markers in the body. Okay, so we then end up with a situation where more anti-inflammatory markers and less inflammatory metabolites and reduced levels of inflammation in the body. Okay, and the kind of combined effects of this over the long term essentially reduce low-level inflammation within the body, which has been associated with chronic diseases like osteoarthritis. And a large portion of my working week involves working with people who are experiencing osteoarthritis and the pain associated with it. And there's a huge benefit from undertaking aerobic exercise and to help reduce conditions like this. Obviously, strengthen around the joints is beneficial, and I'll bang that message till the cows come home. But certainly, aerobic exercise is sometimes underplayed in these type of conditions. As for chronic disease, again, there's large-scale reviews that have looked at this. Our cardiovascular diseases, our heart-related issues, risks reduce, and the risk factors around them reduce, such as high cholesterol and high blood pressure. We get a reduced risk of type 2 diabetes, and again, because we improve the insulin sensitivity within the body. Again, this is something that's driven by improved fitness levels. It's also been shown to reduce cancer rates, including among colon, lung, and breast cancers. And then improve neurological function. So we talked about the higher motor elements, but again, there's associations between reduced risk of Alzheimer's and Parkinson's disease as well. So when we're talking about just managing our long-term health, there's probably a bigger swathe of support for aerobic fitness and aerobic conditioning. And it'd be hard to argue against doing it. And obviously, if there's going to be some knock-on benefits to our golf game as well, then you'd need a kind of a serious argument the other way to say not to do it. So understanding how fit you are and how much work you've got to do is one way to go about it. We measure it using the gold standard measure of a VO2 max. That's essentially a treadmill or a bike test where you go to fatigue, and that measures the maximum amount of oxygen that you can bring into the body. There are many other tests which you can do, which will give a predicted or kind of a rough VO2 max to see where you're at. But the VO2 max test is the one we lean on. And that involves stuff like this. So you put the mask on, your breaths, each breath is analyzed by machine, and that measures the amount of oxygen that you exhale. Okay, so what do we do about it? If we've identified that our fitness is something that we want to try and change, essentially what we have to do is put the cardiovascular system under some pressure. And that's what we're trying to achieve with any kind of exercise. If everything is kind of very easy for the body will sort of say, well, I can do this already, so I don't need to adapt. I don't need to make anything stronger. So you essentially have to get out of breath, which is uncomfortable. People don't always enjoy it, but the body will respond in kind. And it doesn't necessarily, although some people choose to go this way, we're not talking about needing to complete ultra marathons in order to do this. Again, trying to fit your golf game against managing training for that kind of distance events would be challenging and would require a lot of negotiation with spouses in order to be able to do that. But there are guidelines in order to be able to help do this. Now, your starting point is going to be very dependent on what you're at currently. So if you've been sedentary for a long time, then your couch to 5K or even your brisk walks become quite a good starting point. But after a certain period of time, those brisk walks won't be as challenging for your body, and you'll plateau in terms of your fitness. So moving into higher intensity activities such as running, cycling is a good one because again, running can sometimes bring on joint pain for people, although the benefits of running, I would espouse and are actually shown to be beneficial for joints. It's certainly not the wear and tear activity that people seem to think it is. But cycling can be a little bit easy just to get going with and start to increase your intensity, and swimming also can be very effective. But having a measure of improvements is important if you do want to make progress. So it might be that, let's say, if you were going to cycle 20 kilometers, that you time that 20 kilometers, and as you see yourself getting faster, then you know you're improving your fitness. Similar sort of thing with running. Again, if you run 5 or 10K regularly, as your time reduces, then you know it's likely that you're getting fitter as a result. And then how much to do? Again, the research around this would be to try and aim for around 3 days a week, up to around 40 to 50 minutes per session. And between 60 to 75% of your heart rate reserve is where you want it. Like if you're measuring heart rate, is kind of where you want to aim it. Now your heart rate reserve, that's where you use your maximum heart rate and take away your resting heart rate, and you work out your percentage from that. Again, there's plenty of calculators online to try and help it. And then you can be accurate, and you know you're tasking that aerobic system in order to be able to improve your fitness. But it's not a huge amount, and sometimes you can build that into your day as well. Like if you're commuting and you're running to work or you're cycling to work, you can kind of tick some of those boxes as well. And then broadly speaking, there's 2 types of training that you can use. Steady state. So that's where you perform an activity for a longer period of time. Tends to be lower intensity, but usually requires longer training sessions in order to be able to get those aerobic changes that we're looking to try and get. So some of that will depend on your logistics, your ability to fit this into your working week. Or interval training is where we have higher intensity. Now, again, the challenges with this is it's more uncomfortable. So again, one of the reasons that people tend to fall away from aerobic exercise is they don't find it that pleasant. They don't experience the runner's high that people talk about, and it's just more challenging. The upside to the interval trainings, they tend to be shorter. So you can work hard for 2 or 3 minutes for say 4 or 5 repetitions with 2 minutes rest in between. You know, that session is going to take around 20 minutes for you. So it works well for those who are a little bit more time poor. But those are generally the 2 types of training that you can use in order to improve your fitness. And probably the most important thing is that you're consistent. So with any exercise, when you look at the, whether it be that kind of strength training, power training, or fitness, one of the biggest factors for improvement is actually being consistent over a long period of time. So if you complete your 3 sessions a week, and you do that for 30, 40 kind of consistent weeks, then you're going to experience a much bigger improvement in your aerobic fitness. And the fitter you are over a long period of time, the longer that fitness lasts. So you lose less of it, essentially. Okay, the way we measure this and the way we kind of help you with it is using our Fitness Lab service. And to kind of assist with the golf game side of things, we've added in some golf measures for this. So we would measure your VO2 max as part of this test, as well as look at your upper and lower body strength and power and do some body composition measures. And then we also would monitor your swing speed and measure that for you. So depending on the type of game that you want to work on, we complete a retest with this. So if you've been looking to get fitter, we retest your VO2 max. If you've been looking to get stronger and change your swing speed, then we retest and we measure that after that first appointment. Explore that on our website. It's covered by a lot of the insurance policies, particularly with VHI and Leia. And that can be a good way in order to be able to jumpstart this. So sometimes we think we're doing quite well and we've got good levels of fitness, and we find out that maybe not as good as we thought they were or should be. And we can certainly help you in guiding that. So thanks once again for taking the time out this evening, and I'm looking forward to answering any questions that you might have.